Welcome back to our channel, Remedies Life Hacks. Today, we have an important topic to discuss, the top 10 first aid tips that everyone should know. Whether you're at home, work, or out and about, having basic first aid knowledge can make a world of difference in emergency situations. So, let's dive right in and learn these essential health hacks and DIY remedies. I'll be your guide in this informative video. Before we begin, please remember that these tips are for informational purposes only. Always consult a medical professional or call emergency services if you're unsure about any first aid situation. With that said, let's get started. First up on our list is how to manage cuts and scrapes. It's important to clean the wound with mild soap and water, then apply an antiseptic ointment and cover it with a sterile bandage or dressing. Remember to replace the dressing regularly and keep an eye out for any signs of infection. If the wound is deep or won't stop bleeding, seek medical attention immediately. Burns can happen in an instant, so it's crucial to know how to handle them. For minor burns, cool the affected area under running water for at least 10 minutes. Avoid applying ice directly to the burn. Afterward, cover it with a clean, non-stick bandage. For severe burns, seek immediate medical attention. Never pop any blisters that may have formed on the burn area. Heart attacks are serious and can be life-threatening. Familiarize yourself with the symptoms, such as chest pain, shortness of breath, and discomfort in the arm, neck, or jaw. If you suspect someone is having a heart attack, call emergency services right away and provide comfort while waiting for help. It's important not to delay in seeking medical assistance as every second counts. Cardiopulmonary resuscitation, CPR, and automated external defibrillators, AED, can be life-saving techniques. Learn the proper CPR technique, including chest compressions and rescue breaths, and locate AEDs in your area. Being trained in CPR can significantly increase the chances of saving a life during emergencies. Remember to call emergency services before starting CPR. Choking is a frightening situation, but knowing the Heimlich maneuver can help. Stand behind the person, wrap your arms around their waist, and deliver upward abdominal thrusts until the object is dislodged or emergency help arrives. Take a CPR course to learn this technique correctly. If the person becomes unconscious, start CPR immediately. Allergic reactions can range from mild to severe. If someone experiences a mild allergic reaction, assist them in taking their prescribed medication, such as an antihistamine. However, in cases of severe reactions like anaphylaxis, it's crucial to call emergency services immediately. Do not hesitate to administer an epinephrine auto-injector if available. Nosebleeds can occur unexpectedly. To stop a nosebleed, instruct the person to lean forward slightly, pinch the soft part of their nose, and breathe through their mouth. Applying an ice pack to the bridge of their nose can also help reduce bleeding. If the nosebleed persists for more than 20 minutes or is accompanied by other concerning symptoms, seek medical attention. Stroke symptoms can appear suddenly and require immediate attention. Remember the acronym FAST: face drooping, arm weakness, speech difficulties, and time to call emergency services. Acting quickly in a stroke situation can greatly improve the chances of a positive outcome. Note the time when the symptoms first appeared, as it's important information for medical professionals. Sprained ankles are common injuries, especially during physical activities. Remember the RICE method: rest, ice, compression, and elevation. Allow the injured person to rest, apply ice packs wrapped in a cloth for 15 to 20 minutes at a time, wrap the affected area with a compression bandage, and elevate the leg above heart level to reduce swelling. Consult a healthcare professional if the pain or swelling worsens. Last but not least, knowing how to clean and dress wounds properly is essential. Always wash your hands before and after treating wounds, use disposable gloves if available, and dispose of contaminated items safely. Gently clean the wound with mild soap and water, or a saline solution, and pat it dry with a clean cloth. Apply an appropriate dressing or bandage to protect the wound and promote healing. Monitor the wound for any signs of infection and seek medical attention if needed. And there you have it, the top 10 first aid tips that everyone should know. Remember, these tips are meant to provide general guidance, but it's crucial to seek professional medical advice when necessary. Stay prepared, stay informed, and most importantly, stay safe. If you found this video helpful, give it a thumbs up and share it with your friends. Don't forget to subscribe to our channel for more health hacks, DIY remedies, and life-saving tips. Thanks for watching, and we'll see you in the next video.